Hi, I just wanted to make a quick video in response to your comment. I know for a fact that the campaign against painful hysteroscopy, which I am not a part of, but I know on these 2 points I know for certain because they've told me enough times, is that one, they do not want outpatients stopped. They just want certain balances and measures in place, protocols in place, not guidelines, forcible or non-voluntary protocols in place, i.e. monitoring of pain and knowing when to stop and informed consent. And the other thing that they get quite annoyed at is that it seems to be a paracetamol or a GA. And I have to say that I've come across spoken to a few women that say, they've had a GA because they were offered nothing, especially if it's a second one. If they had more than if they've done an outpatient already, and I also hear women having outpatients that don't want a GA, but they've not offered anything in between. Right, from now on, anything I say is what I say and what studies I've read. And you say that there are many benefits to outpatients. Well, I'm finding that the benefits are vastly exaggerated, and the risks are greatly understated and overstated for anaesthetic side. Well, let's take the anaesthetic side. Under GA, I have read a study. It is an older study, but I can dig it out if you like, and it says that there is no increased risk for diagnostic operative. There is a noticeable or measurable increase in complications, but for diagnostic only, there is no increase. Now, there are a few caveats to that. One, teaching hospitals, we noticed that is the case because they're learning under a GA, and that's not the right place to be learning. You need proper simulators for that. Also, we're noticing that things aren't being reported for outpatients. I've heard several times this week of women passing out after they've left the hospital, and I've heard of cases where women have had to walk out the outpatient side and walk back in through the other door to the A&E side because they're in that much pain, and it was obviously a perforated wound, but it didn't want to be classified as an adverse event. And I know women personally that have had two false passages and not been recorded as adverse events. So that goes by the by. Also, the recovery time. Yes, when it comes to a GA, there's the fasting time, the waiting time, and the recovery time. However, I don't know anyone who's been sick, vomited after a GA without post-operative opioids. That's another matter. But there are in-between painkillers or pain reducers like diphactic suppositories. Now, they take about 1 off the VAS score, but that's the study I saw was for oral. So suppositories may not take more pain off. Gas and air, I hope you've got gas and air there. If you haven't, please get it. Cervical blocks. 4 points, not 3, and we find that allowing them enough time to soak through to an internal loss is a big issue. Many just try to carry on straight away, and we know why. It doubles the appointment time. Now, I'm finding that when they say most women tolerate this well, I'm sorry, but that's just semantics. Most people voted for Brexit. That's only 52%. It's just an engagement in semantics. Tolerate just means endured. So do most women endure this? Well, you don't know that because you're not asking them. And when I say asking them, I don't mean immediately after you stopped and then in the recovery room. It means an actual 3-month follow-up. It means actually asking them down the road and seeing whether their experience will inhibit them from another hysteroscopy or any other gynecological procedure. Also, we're noticing that they don't want to use flexible hysteroscopes. Now, the latest scopes have got a good enough view. Now, is this because flexible hysteroscopes can't be forced through, and especially on postmenopausal women, force has been relied on to pass it through? So that's another issue. Also, when it comes to informed consent, offering them a GA and saying some women find this uncomfortable or some women find this painful is not really informed consent. When the RCOG did their study, they found 26% had severe pain and 46% had moderate pain. Well, that's 72% had pain, not uncomfortable, had pain. So unless you're saying the truth is that most women find this painful, whether they find it acceptable is another matter, but most women find this painful. So we're finding also that when we're speaking to anaesthetists, that they actually, quite a few actually do hysteroscopies with the spinal rather than sedation and analgesia, as they find that that's quite a skilled, getting the blend right is quite skilled, but they actually like to do theirs under spinal, and they say that they can get theirs in and out under 2 hours, within 2 hours. Well, I'm hearing in some cases a far longer recovery time than 2 hours, especially for operative ablations. It's not uncommon for you to keep women overnight, and certainly for a few hours because of low blood pressure, if you are monitoring low blood pressure. Also, if they're finding women are having this outpatient and leaving immediately, basically you are not monitoring them long enough. 20 minutes, do you feel well enough? Yeah, you can leave, is not monitoring them. So in short, there are intermediate pain reducers. Are you offering them? Are you telling women it is painful, it's often painful, some women find this traumatic? This is the important one, are you monitoring them with VAS, with a visual analog score? Because we know why most of them aren't, because if you were and you stopped at 7 out of 10, which is really should be the cut-off point, that you would be stopping 2 out of 10, 1 out of 5, and that's being generous, very generous. The reality is it's probably more like 3 out of 10, and that's for diagnostic only. Operative is probably 4 or even 5 out of 10 if you're stopping at a VAS pain. So please, 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 in future, will you monitor your patients with VAS, because you will find that it's a lot more painful than you think. And will you please actually follow up patients and see whether they are actually tolerating this well. I know it's a 9-minute video and I've gone on longer than I want, but hopefully you'll watch this. Thanks, bye.